Lately, you have probably been hearing a lot about telemedicine and Medicare and how those two things work together. With the coronavirus epidemic happening right now, it's super important for people to stay home as much as possible. And a lot of the providers and carriers are making it easier for you to see a doctor without leaving your home. So that's exactly what we are going to be talking about today. Hi there. My name is Joe Hutchison. I am an independent life and health insurance broker with Founders Life and Health. I am based here in beautiful St. Louis, Missouri, but I have clients and I help people all over the country find the right Medicare plans for them, and more importantly, once they find their plans, using all the benefits that are in those plans. So what we're going to be talking about today is telemedicine and telehealth. You have probably heard quite a bit about it in the last couple weeks as we are all currently dealing with the coronavirus epidemic, and the most important thing for all of us right now is to stay in our homes. So we've been getting a lot of information from the insurance carriers. We've been getting a lot of information from the CDC and from the World Health Organization, encouraging us, obviously, to all be in our homes as much as we can. And for those of us that need to see a doctor, there are more opportunities for telemedicine and telehealth available than have ever been available before. So how do we access those resources? To start with, I would encourage you to get in touch with your provider, whether you have a Medicare Advantage plan, whether you have a Medicare supplement, whoever is the carrier for your plan, whether it be Humana, Cigna, United Healthcare, Medica, any of those companies that are providing your Advantage plan or your supplement are going to have clear direction on how to access telemedicine. That could be your first stop. Your second stop could be your doctor directly. If you have a primary healthcare provider, please contact their office and find out how they are doing telemedicine. They may have their own portals already set up. So by contacting your doctor, they can point you in the right direction. They can get you to the website that they use for telemedicine, and that could be the fastest route to get online and actually seeing a doctor if you need to. For some of the bigger carriers, they are all using Amwell. So if you go to the website amwell.com, which I will put right here for you, the providers that are using Amwell are Aetna, Anthem, Blue Cross Blue Shield, Cigna, Medica, Oscar, and United Healthcare. There are a lot more companies than that are using Amwell, and I believe more will be signing up as things move forward. But if any of those companies are the carrier that you're currently using, then you can go to the amwell.com website and register online, and it will take you, it will get you registered and take you directly to see a doctor. Once you get online and you are actually face-to-face with a doctor, please keep in mind, obviously the doctor cannot take your temperature, they can't take your blood pressure. Everything that they're going to be looking at, they're going to be assessing visually. So the best information they can get is from what you tell them. Tell them about your symptoms, tell them about your concerns. They can, not in all states, but in most states, they can prescribe through telemedicine. So if you're in a particular state and you're not sure whether or not that doctor can prescribe medication for you or not, make sure that's one of the first questions you ask, because if what's ailing you, you believe is going to need a prescription, and that may not be something that doctor can provide for you, you probably want to get that known up front. One more piece of information that I think is really valuable, there are not only physical health services available through telemedicine, but there are also mental health services available through telemedicine currently as well, which in this environment with as much stress as we are all under and being locked in our homes, I think mental health is more important than ever right now. So one of the companies that is offering mental health services through telemedicine is Optimum Behavioral Health, and you can go to their website, you can register. Again, please check with your your Medicare Advantage plan or your supplement plan and make sure that the costs are covered. Most of the time, I believe they are being covered, and a lot of the coverage has been expanded to include mental health. So that is going to be a little bit longer of an appointment. That's going to be anywhere from 15 to 45 minutes. Your carrier, your Medicare Advantage or supplement plan carrier can give you more information as far as how many mental health visits you can have during a certain month. So definitely check all that out. And if you need more help with figuring out what your plan will cover and what it will not, I'm happy to get in touch with your carrier for you and get all of the details. So I hope that was helpful. Please take care of yourselves. If you are feeling sick, please get in touch with your doctor. Get on a telemedicine call. Find out how you can get the services that you need without leaving your home, if that's at all possible. We want to make sure that you are as healthy as you can be and that you're getting all of the help that you need.